talk about the hemophilia. And basically, the hemophilia is a bleeding disorder that the bleeding takes a long time, and it usually occurs in men, and 1 in 5,000 born men has hemophilia. This is about as triplets, and this because change occurs in the gene of the chromosome X. So what this change causes insufficient concentration of the clotting factors in the blood, and the hemophilia has two main types. The hemophilia A, the low concentration of the clotting factor 8, and the hemophilia B, this is related with the clotting factor 9. And the hemophilia A is more common. And the main the common symptoms is the easy breathing and excessive bleeding, and the bleeding can be internal or external. The internal bleeding can cause swelling and pain in the joints, and the delay in the treatment can cause loss of motion. And they also can be blood in the urine and the stools. The hemophilia is a genetic disease, and this is hereditary, but there are some rare cases of acquired hemophilia. How the hemophilia is related with the chromosome X, where it's not common happen with women, because two women have hemophilia. She need to have the 2 chromosome X with the gene of hemophilia. And if the man has the chromosome X and chromosome Y, when the man has the chromosome Y with the faulty gene, he has hemophilia. So when the woman don't have just have 1 chromosome with the faulty gene, she is a carry hemophilia. So in this diagram, the first diagram, we can see that the woman is a carrier, and she can pass through pass the hemophilia gene to her daughter, and the son can have hemophilia. In the case when the father is has hemophilia, and the mother no, and the daughters of they will be carry hemophilia, and the son will not have hemophilia. So the patients will have blood test to figure out how long the blood takes to clot, and how the concentration of the clotting factors the patient have in the blood. So the hemophilia, even hemophilia A as hemophilia B, can be classified in mild, moderate, and severe. Mild is related to 5 to 40% of the normal clotting factors from the body. Moderate 1 to 5% of the normal clotting factor from the body, and severe hemophilia is when the patient has less than 1% of the normal clotting factor. And both hemophilia has the same bleeding problems. Only with the blood test can identify what type of hemophilia the patient has. So the treatment is more common is replace the missing clotting factors in the blood through the vein. And there are some gene therapy in test, and the hemophilia don't have cure yet. But depending on the type of the hemophilia the patient had, there will be different treatment. When the patient have mild hemophilia, replace treatment is not usually. But in some case, when the patient has hemophilia, mild hemophilia A, they can use desmopressin. And when the patient have moderate hemophilia, they can use replacement therapy in some situations when bleeding occurs, or will do some procedures. Or if the hemophilia was a moderate hemophilia, the doctor can indicate the desmopressin. And it's more common. The hemophilics have the hemophilic severe, but the severe hemophilic just use replacement therapy at home two or three times a week, and this is a preventive therapy and can continue lifelong. And I will talk about the desmopressin. It is a drug used with the mild hemophilia. So this is the structure of the desmopressin. The desmopressin is a synthetic analog of the natural hormone vasopressin, and it's a specific agonistic drug that interacts with the type 2 of the vasopressin receptor and of the endothelial cells. And in this second structure, we can compare the desmopressin and the vasopressin, and we can see in the first amino acid of the desmopressin is deaminated, and in the 8-arginine of the desmopressin have the destro form, and the vasopressin is a levo form. So to understand the mechanism of the desmopressin, we can first understand how the blood clots. So first, when the plaquettes incur damaged vaso walls, they became activated and became stick. So the plaquettes start to stick together and stick with the walls of the major site. But when this plaquette plug is not strong enough, and the blood pass through the injury can take this plug away. So it's necessary to reinforce and increase the adhesion of these plaquettes to the blood walls. And so where is the clotting factors entered? The clotting factors became activated and added themselves to the platelet plug, and in this way they reinforce the platelet. There are different types of platelets, and after different type of the clotting factors acted as a glue. It's a fibrin. The fibrin holds the platelets and other clotting factors together, creating a blood clot. And other cells like red blood cells and white blood cells can get caught in this web and help reinforce the clots. So these clots stay in this site damaged until the tissue is fine, and when it's not needed longer, the blood dilute the clot. So how the hemophilia is a low concentration of clotting factors. So what the desmopressin do is it induce the secretion of the von Willebrand factor. Is one protein that carries the factor 8. So the desmopressin interacts with the type 2 of the receptors of the vasopressin and stimulated the von Willebrand factor release. And this Willebrand factor is a carrier of the factor 8. And this way reinforce the clot. So the desmopressin has different routes of administration, can be intranasal, intravenous, subcutaneous, oral. Has half-life the 55 minutes, and subcutaneous and intranasal are at least as efficient as intravenous and can be self-administered. And the intranasal and intravenous showed has a factor 8 activity in 30 minutes, and maximal response was observed with dose of 0.3 and 0.4 micrograms per kilograms of body weight. The bioavailability of the intranasal is 3.5%. The others show a low bioavailability, and the excretion is through the urine. So some adverse reactions will depend on the route of the administration used and the dose used. But in some examples of the adverse reaction with intravenous was headache. The intranasal was like abdominal pain and sore throat, weakness. The intravenous and intranasal desmopressin has some case of the acute allergic reactions and includes isolated fatal case, and the desmopressin is not indicated for hypersensitive people to any of its components. So what desmopressin do is increase the factor 8 activity of the patient with mild hemophilia. It's used the immunosurgery such as a